Morning everyone, welcome to my YouTube channel. In case you are new here, my name is Nafisa Suleiman and today we'll be talking about the management of drug abuse in young adults and in pregnant women. First of all, what is drug abuse? Drug abuse can be defined as the use of drug in excessive amount for non-medical purposes which may be harmful to the individual. Examples of drugs commonly abused are alcohol, barbiturates, amphetamines, opioids, nicotine-containing drugs like tobacco, marijuana, and club drugs. About 270 million people in the world abuse drugs, and about 35 million of these people have been reported to have substance abuse disorder. About 2.6 million youths between the ages of 10 to 24 die each year due to drug abuse in the world. If a huge step is not taken to properly manage drug abuse, in a couple of years, we would have lost more than half of the population to drug abuse. Drug abusers are at risk of having immunocompromised disease like HIV/AIDS, hepatitis B and hepatitis C due to the use of needles. Some of the signs and symptoms of drug abuse include changes in mood, changes in physical appearances, difficulty concentrating and thinking clearly, and social withdrawal. There are so many reasons why people abuse drugs, some of which are to feel good, peer pressure, depression, and excessive use of opioids, which may lead to addiction. However, the disadvantages of taking these drugs outweigh the benefits and they can be potentially harmful. What are the disadvantages of drug abuse? There are several disadvantages of drug abuse, some of which are the drug abusers, they tend to use these drugs even in physically dangerous situations. And drug abusers, they usually have a hard time controlling the use of drugs because of the withdrawal symptoms that persist each time they try to stop using the drugs. And drug abusers, they may go as far as stealing just to maintain the supply of drugs. They steal money to buy these drugs. And drug abuse can lead to damage to internal organs like the liver, the brain, and the heart, which is why drug abuse have to be properly managed. So there are some management strategies that have been used for drug abuse in young adults. There are two pharmacological agents that have been used for treatment of nicotine dependence in young adults, which are nicotine replacement therapy and bupropion. Nicotine replacement therapy is a short-term therapy that involves the use of replacement for nicotine like nicotine chewing gums, transdermal nicotine patches, nicotine lozenges, and nicotine nasal sprays. These have been seen to be effective in helping nicotine-dependent users to abstain from nicotine, because this replacement would mimic the effect of nicotine. Bupropion is a monoamine oxidase transmitter and it inhibits the nicotinic acetylcholine receptor. Naltrexone and disulfiram have been used in the treatment of alcohol dependence and cocaine dependence, although naltrexone should be avoided in patients with severe renal impairment and also should be avoided in pregnant women, and you should not be taken with opioid medications to avoid precipitation of opioid withdrawal. Management of alcohol dependence in pregnant women. Since these drugs that I've mentioned, the naltrexone and the disulfiram, are contraindicated in pregnant women, you might be wondering how we treat alcohol dependence in pregnant women. Alcohol dependence in pregnant women can be treated with short-acting benzodiazepine like diazepam with a starting dose of 10 mg up to 4 times daily. Although these benzodiazepine drugs like diazepam are potentially teratogenic, so the risk versus the benefit of the use needs to be assessed. Management of opioid dependence in pregnant women. Opioid dependence in pregnant women can be managed using opioid replacement therapy. And there are two drugs that are safe for opioid replacement therapy in pregnant women. They are methadone and buprenorphine. Methadone can be administered at a single starting dose of 20 to 30 mg daily, followed by a maintenance dose of 5 to 10 mg up to 4 times daily. Buprenorphine can be administered 2 mg up to 4 times daily. So drug abuse and addiction can lead to death and can cause serious illnesses. Therefore, it should be properly managed to save life, to improve health, and to reduce risk to the society. Thank you all for watching. I hope you did enjoy the video. If you did like the video, please hit the like button and don't forget to subscribe to stay tuned for more interesting videos. Bye guys.